Hello, my name is Stuart Howard. I am currently a student nurse practitioner at Youngstown State University. This is our first assignment and it is a self-assessment on my strengths, weaknesses, and plan for growth as I start my first clinicals. I am currently working as a registered nurse in an urgent care setting. This is a role that I've had the privilege of serving in for the past 8 years. During this time, I've gained valuable hands-on experience managing a wide range of acute presentations, including rashes, upper respiratory infections, bronchitis, influenza, dysuria, COVID-19, lacerations, concussions, fractures, and even mental health crisis. These experiences have sharpened my clinical judgment, my ability to stay calm under pressure, and my communication with patients from all walks of life. I've become confident in gathering histories quickly, performing focused assessments, and triaging safely. One of my core strengths is recognizing patterns of illnesses. When someone walks in with a sore throat, a rash, a chest pain, I can often anticipate what we're dealing with and what might be needed next. For example, I can do a strep test for a sore throat. I can do an EKG for a patient with chest pain. I can do a flu or COVID test if the symptoms and timing are right. I can get a urine sample for someone that may have a urinary tract infection and do a pregnancy test if a woman is of childbearing age. I've also developed a solid understanding of non-pharmacologic interventions. Things like rest, hydration, patient education, or lifestyle changes that support healing. But as I step into the advanced practice nursing role, I'm also becoming aware of my areas for growth. One of my greatest challenges is transitioning from thinking like a bedside nurse to thinking like a provider, especially making accurate diagnoses and choosing the most appropriate pharmacologic treatments are areas where I feel the least confident. As a nurse, I've supported providers in delivering care, but now I am learning to be the one making the decisions. It's a big shift, not only in responsibility, but in how I approach clinical reasoning. I want to improve my ability to select medications based on pharmacokinetics, patient comorbidities, allergies, and evidence-based guidelines rather than just recognizing what was ordered or administered. To address this, my plan includes spending focused time reviewing clinical guidelines from sources like UpToDate and the CDC, using case studies and simulations to practice diagnosing and prescribing, learning from my preceptors and instructors by asking more questions, especially around their clinical decision-making process, continuing to build my knowledge for drug classes, side effects, contraindications, and patient-specific considerations. One of the objectives in this course is to implement the advanced practice nurse role in health promotion, disease prevention, anticipatory guidance, and management of acute, episodic, and chronic illness. I am confident that my urgent care background gives me a solid foundation in acute care, and I am committed to strengthening the advanced reasoning and prescribing side of my role so that I can offer more complete care, especially to diverse populations at every stage of life. A key part of this development involves integrating theory and research from both nursing and other disciplines into practical healthcare management. This means taking what I've learned academically from pathophysiology and pharmacology and applying it directly to patient care. For example, I've learned to use the CDC guidelines when treating respiratory illnesses and to apply evidence-based screening tools when addressing mental health concerns in adolescents. Another area of growth for me is me improving my ability to assess, diagnose, and manage a broad spectrum of conditions. While I feel confident in conducting patient interviews and focused physical exams, I am actively working on refining my skills in developing differential diagnosis and formulating treatments that address both the presenting issue and underlying contributing factors. I also recognize the need to become proficient in combining pharmacologic and non-pharmacologic strategies into personalized treatment plans. I already have a strong foundation in non-drug-based approaches such as education and lifestyle counseling. I am now focusing on becoming equally skilled in safe, effective, and evidence-based prescribing. Equally important is my ability to develop holistic care. I want every patient interaction to go beyond addressing the immediate issue and also include education, prevention, and anticipatory guidance. For example, when treating a patient for hypertension, I want to take the time to talk to the patient about diet, exercise, stress management, and medication adherence, not just writing a prescription. Finally, I am committed to upholding the legal and ethical principles that guide healthcare decision making. This includes respecting patient autonomy, ensuring informed consent, protecting confidentiality, and always acting in the best interests of the individual or family. It is important to me that my clinical decisions are not only evidence based, but also ethically sound and culturally competent. Ultimately, my goal as a future NP is to be a caring, competent provider who meets patients where they are and delivers timely care, thoughtful, and backed by knowledge. I'm excited and very humbled by how much there is to learn, but I know that I'm in the right place.